Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. As we mentioned prior to the commercial break, our first segment this morning will be a formal COVID-19 update with the Director of Health Services, Dr. Marvin Manzanero, who is presently on the line with us. Good morning, Doc.
Hi, morning, Marlene, Armin.
Isani. That's fine.
Isani.
Doc, let's begin by getting an update or a synopsis on the state of affairs in San Pedro. I know that is currently perhaps the primary focus right now. What's been taking place there over the past few days since your last appearance?
Yeah, well, I can't recall when was the last time, but I think it was sometime last week. But I do know that over the last 3 days, Wednesday, Thursday, and Friday, we had a significant number of cases, with clusters eventually showing up more in Orange Walk and in San Pedro. To date, we have identified 3 specific clusters in San Pedro. And of course, once you start having more cases come out from those clusters, then it's going to be difficult for you to say to which cluster they really belong. So we categorize it as community transmission for San Pedro town, given that we are already having or seeing possible links between clusters that were going there. To date, we have more than 50 active cases in San Pedro, and we have more than 100 samples to be processed from San Pedro and Belize City.
Okay, so let's talk about what was updated. What was part of the update on Friday? I know you had your surveillance team join you and ask the experts, and one of the things they talked about was a change in how you would be following through on potential positive cases in San Pedro. Since there is community spread and there are a lot more cases that have to be tested, are you now at the point where you are not going to test every suspected case on San Pedro?
No, well, the first thing we will have to do, and I think when we did the ASA experts on Friday, we didn't have any confirmation of where the preliminary positives were coming from, though we did confirm eventually that there were 32 reactive samples. Half of those were from San Pedro. What you normally would do in this kind of situation is you go first for the ones that are symptomatic, not the ones that are necessarily all the contacts of a given positive.
Yeah.
So that's what we were trying to get the message across on Friday. Some of the services that we routinely offer at the clinic were just not being done. We went into emergency mode, and that will continue at least through the first portion of this week until we have gotten a sense of all those symptomatic cases. Because again, it could be that there's something else there, but you have to assume for now that all the symptomatic cases are going to be SARS-CoV-2. So for now, we should be able to be testing all the symptomatics. Granted, there will be a point in time when if you have one confirmed positive in a family, they are living together, then probably the next 5 or 6 ill in the same family, you probably don't have to test them.
Okay, so right now, if someone is asymptomatic or has no symptoms but has been in contact with a positive case, they probably won't be tested.
Well, what we have asked for persons is primarily for them to go into isolation first.
Okay.
Because we're trying to screen all the symptomatics and then layer it out. In some communities, it might be easier than others. I know that, for example, in some communities in Orange Walk that may have had cases of people who left the island, even though they are asymptomatic, they have been tested. Similar situation in other areas. We know people who had left San Pedro and went to Cayo, went all over, and who are not having symptoms. They have still been swabbed. Because in other areas you still have the ability with your health staff. You don't have that many people wanting to be tested. In the island, it wasn't that easy, and I know that there were concerns and situations where people were standing long hours in San Pedro needed to be tested, but that's precisely because you had a higher number of symptomatics there.
So you're trying to get through all the symptomatic cases, but in the meantime, you're asking everyone who knows that they've come in contact with a positive case, if they've been contacted by the Ministry of Health, to self-isolate.
Yeah, and even if we have not contacted, because I do know that through the weekend we managed to reach everybody that is a potential or has been exposed. And I'm saying this because, on Saturday, on Friday, and some of the samples on Saturday, your list of contacts just continues to increase. As I said, we are following 3 clusters in San Pedro. I think the one that has the potential to get out or has already moved out is the one related to a construction site. The church situation in San Pedro, I think, is an easier one in the sense that it has pretty much managed to reach that specific congregation and swabs taken. In terms of case number 57 that gave us 17, 18 samples, remember this is 2-3 weeks ago. But the people who are from the construction site who don't live on the island and who may have left or who have left are the ones that we are primarily looking for, and most of those are men who live in northern villages, Orangewa primarily, and some in Corozal villages.
What is the update, if there's any, on the situation in Shipyard and Santa Marta?
Well, from Shipyard, we have a cluster that we identified on Saturday of, I believe, 12. But they are all one single family. So even when you look at the numbers in Orangewa, you have one big cluster of 12. The Santa Marta cluster has about 8 now. 3 of those may be out of Santa Marta now. The case in Stan Creek district that we reported is a family of the initial cluster identified in Santa Marta. So the mapping of those particular cases is pretty much concluded. I think the ones we are following right now are the ones in San Pedro who have left. And that's the concern, because if you are in the island of San Pedro, even though you're from the construction site, well, it's under lockdown, you shouldn't be moving out.
Yeah.
But it's the ones that moved out. In Belize City, we identified, I believe, 3 cases from the Friday batch, and those would be linked to San Pedro, 1 linked to Orangewa, but contact tracing yesterday, today, and the early part of this week can also give you a general sense of where we are going. Concern also police officers. Yesterday you heard of a teacher and 6 health personnel that have turned out positive as well.
Now, I'd like to give you a right of response to the statement that was issued over the weekend as well by the Belize Medical Dental Association. Can you share with us your perspective from the Ministry of Health with respect to what was said?
Yeah, well, I actually spoke with Dr. Mughela. He was in my list of people who was calling Saturday morning. And just when I was calling him, somebody sent me the press release that they had put out. That press release wasn't really consulted with anybody, as far as I know, from the Ministry of Health. I'm not sure what specifically they are referring to in terms of a doctor being forced to work under such conditions. On the score that 3 of the personnel are not from the Ministry of Health.
3 of those who tested positive.
Yes, 2 doctors and a nurse are from private sector alone. They don't work in public sector. 1 pharmacist from health, 1 nurse from health, and 1 doctor from health are the ones who have turned out positive. The pharmacist who turned out positive was actually on vacation. He had just come back to work and was symptomatic. So we don't anticipate that he got infected the incubation period wouldn't really add up to the time frame. The doctor and the nurse, both in Orangewa, have not been the first line caregivers of those identified cases that we know that are in the system, that are hospitalized then. So we are also not thinking that they are getting infected in the within the health system. So that's also a
They had
consideration.
no contact at all with the COVID-19 positive case that was hospitalized there?
Yeah, but the time frame wouldn't add up the incubation period from when they were detected to when they were to when they had contact. It doesn't appear as a source of contact there, and people who had closer contact to that case have not turned out to be
Just
positive. So, as I said, we don't the investigation that we have done doesn't point to the fact that they got it from the hospital where they work.
I want to be sure I understand. So the doctor and nurse who do work, well, to be clear, 6 healthcare workers have tested positive for COVID. 3 are from the private sector, 3 are from the public sector. The doctor and nurse in Orange Walk, you're saying, did come in contact with the COVID-19 patient, but because of the date that they started to be symptomatic, you feel that
The doctor doesn't appear as being the caregiver of this patient that was hospitalized. The nurse is classified as she's not the caregiver of this person. Actually, she appears as a secondary contact, which means she's a contact of whoever was taking care of that patient. She's not the primary caregiver of this patient.
So that individual has been identified?
Who?
The primary person that was in contact with the patient.
Yeah, from the healthcare. It's a healthcare worker. It's another healthcare worker.
okay. And no one else has tested positive who
No,
came in contact with that patient?
as immediate caregiver.
Okay.
Also, you see what this also helps to underscore, and I had to send an internal memo last week, Wednesday, to health staff across the country, Ministry of Health offices, to make the use of the mask mandatory, because Tuesday and Wednesday we had actually gotten complaints from, and those were on social media as well, from people who were saying they're demanding that we wear a mask when we come into the health facility. But the people inside the health facility are not wearing a mask.
Yeah.
And those photos circulated of staff within hospital settings not wearing a mask but requiring it from the patient. And that's a valid observation. So if we are not being careful, even if you're careful at work, even if you take your necessary precautions at work, but you go out in public and your guard is kind of let down because you assume that it's only within a healthcare setting that you can become infected, then I think we're going to be having a problem, because you can shut down an entire system because of that. I spoke with Commissioner of Police on Saturday morning to also flag the situation with police officers, because we had been told that at least 5 police officers on the island of San Pedro were symptomatic. I believe they have been swabbed and those samples will be processed today. We have identified so far 4 police officers positive. So if we are not careful in everything that we do, we can't just assume that all the risk is going to be tied to a health system.
Agreed. I think that there has to be a collective responsibility. But the difference, though, Dr. Manzanero, is definitely when you work in a situation where you are at higher risk, a healthcare professional or a police officer, it is a part of their occupational safety that they're provided and informed. They're provided with what they need and informed of how they should use it or what the protocol is. And so that is my question. What is the current mandate from the Ministry of Health in all health facilities about interacting with patients? We're at a point where, I mean, you've said it many times, assume every single person has COVID-19. So if it's a child with diarrhea or an adult with a headache coming into a clinic, are they all being treated as if though they are possibly COVID patients, and are the frontline personnel provided with the proper gear?
Well, again, it has to do with levels of interaction. Whether it's really happening, it would seem at times that it isn't. I know that the situation when the patient was identified in San Ignacio, I had one of the nurses call me to say, do I need to be tested? Very worried, I can understand that. And my first question to her was, were you wearing a mask, regardless of whether you're assuming this patient is COVID-19 positive? She said, not initially. She only started wearing a mask when the doctor said this is a potential case. Were you wearing gloves? No wearing of gloves. And so I said, in the advice to her, well, this is where we start to have and run into problems because we should never have let our guard down. I know it happens with general public. If it happens with the healthcare worker, then you can assume it's going to happen elsewhere. Now, I'm not putting any blame on anybody. I don't think at this point in time we need to start going down that road of just throwing things at each other.
Yeah.
I think the situation is we have to assume that every patient you have is a potential case and take the necessary precautions. Now, where you are, as you are saying, well, it depends if your level of interaction is going to be. If you have a patient that's visibly symptomatic, then your level of PPE, personal protective equipment, is going to be different. But if you are a healthcare worker that is not really having an interaction with patients, or depending on the type of patients you are seeing, if you're in the outpatient department seeing chronic patients, then your level of PPE is going to be different than somebody who is in the flu clinic, than somebody who is seeing patients in the emergency department, than somebody who is in the ICU. There are levels of care. We had to send another note also to health staff across the country, I believe just yesterday, in terms of what is anticipated also with levels of exposure. Because suddenly you have, not only in health, we had multinationals, big companies calling us through the weekend because now half of their staff doesn't want to turn up to work today, Monday, because they are first secondary contact of a contact, so to speak. So because I am a secondary contact of somebody who is a primary contact of an identified case or a suspect case, I don't want to go to work. And we are seeing this coming up from big institutions across the country. So I don't know how we're going to go about this week when people just suddenly.
And I want to come back to that because that is a critical point as well. But before that, just so we could really summarize what's happening with the healthcare institutions, are all the facilities equipped with sufficient PPEs? We've seen a ton of donations for personal protective equipment to the Ministry of Health, also to the police. But have they been equipped with the gear, and who releases it? Because I know a long time ago you spoke of having it put away because you didn't want them to use it when it wasn't necessary.
Every region requests based on use. So if you anticipate, well, one is everybody will have a basic stock, but people like Corozal, Orange Walk have been getting a more weekly supply.
Yeah.
Even Corozal and Benque have been getting more supply simply because of what they are exposing themselves to at the border, and the Central Health Region with the repatriation process. Carlucia has the stock. They got further stock this weekend. So they have, it's usually done, well, every management team at each region would decide who manages it, whether it's infection control nurse and what mechanism they have. We do want to ensure that they do use it when it's required, though, because you don't have an endless supply of. And I'm saying this because we have had, I mean, in March, April, we had people wearing hazmat suits, almost the full PPE overall, whenever they went to swab somebody at their home. Those things are not supposed to happen. These are people who are asymptomatic, and who even had a first reactive test that was a first test that was negative. Then. So you're just doing a follow-up test. You don't need that full suit to go out and do that.
So you're saying that all the facilities do have the equipment, but the disbursement of the equipment is under infection control nurse or personnel there?
So whoever the region decides, because Corozal would have their, I don't know who manages their stock.
Okay.
And whenever there's a documented need, they just send it to us and it's sent back to them.
Is there any type of synchronization with what's happening at private healthcare facilities? We saw, as you've noted for yourself, half of the current positive cases of healthcare workers are from private facilities. You have private facilities, you have NHI facilities. How are you ensuring that the same level of protection is taking place across the board?
No, I would not be able to comment on what happened in private sector and what level of exposure they had. I believe that the regions following these cases would have a better sense, but I did not get any notes as to what levels of PPE they are using. I do know that a couple of entities did say that they were having difficulties accessing or procuring PPEs. Some of our PPEs are also gone back when the port was closed, I believe. Some material items had not arrived. But no, I would not be able to comment on what their procurement process or what level of use they have at the private sector level.
Let's go back a bit, Doc. You mentioned earlier that there have been situations where calls have been placed by persons who say they are not showing up to work because they are secondary contacts, so to speak. Would this be justified? Perhaps if those individuals say, you know what, I was in direct contact with someone who was initially in contact with a positive case, and I may not show up to work today because I fear that at this point, perhaps I too am positive. Is that justified to say that at that point they will refrain from showing up to work, perhaps to get tested? Or what is your outlook on that? What's your recommendation?
Well, if you're symptomatic, you obviously have to stay home, whether you are a contact or not a contact. If you are a secondary contact, would you be justified? Well, as we always tell everybody, if you wear a mask properly and you're doing the physical distancing, because I know that we have said whoever you meet on the street is positive, maybe before the end of the week, we're going to have to tell people out on the street, we have to consider that we are also positive and we're trying to protect others. So if I know that I have been exposed, potentially exposed, let's say I'm a secondary contact, assume it's me then, would I go to work? I would go to work, I would wear my mask, and I would try to keep physical distance in as much as I can. Of course, it depends on the level of work you do. And I think it's important to inform others around you where exactly you have been and what is your considered risk, because it also depends on what level of contact you had with any single person. I mean, if you are a casual contact, so to speak, let's say I work in the same department, it doesn't mean that I don't go to work if I have no interaction, because I know people are saying, well, we won't go back to the workplace until the work is sanitized. But if I am taking my own precautions, then I don't see that that would be a reason for not going to work. It depends on the level of contact you have had.
So, I mean, it's a tough call. So, what we're calling secondary contact is someone tested positive, they had a close contact. That is their that is a primary contact. And then any person who came in contact with that person are now considered a secondary contact.
Yeah.
So naturally, given the number of cases that we're seeing at this point, there may be 2-degree, 3-degree separation between all of us, you know. So is there going to be some guidelines as to what you can do? So I think you mentioned it in your one of your appearances, just if everybody who's a secondary contact stops going to work, we're going to have a shutdown of workplaces. But if they are to go back, they may potentially have been exposed. Mm-hmm. How should they do so in the safest way? And when do you make the call as to whether or not you remove them from the workplace or let them work from home?
Well, again, the thing is, through the weekend, we also get the people who are tertiary contacts also saying that they are not good to work.
So primary contact, let's start there. Primary contact should stay home and wait to get tested, or self-isolate. Let's start there.
How you are appearing on the line listing, because we have people who say that's another thing. People saying that they are primary contacts.
Okay.
But if they don't appear on the line listing, let's say you say you're a primary contact with me, but I have not named you, then when health goes and does their investigation, then you don't appear on the list. So you might be waiting to be tested and nobody's going to show up.
Yeah.
And also the primary contact is determined by whoever is doing the investigation, because if you have been just because you can be a primary contact, if you will, but you are a casual contact as well. If you had an interaction, 2 minutes, everybody was wearing a mask, then there's no situation there that you need to be concerned about. So I think it's
So
the
you
level
may
of,
be a primary contact, but not need to self-isolate or be concerned.
yeah, it depends on, as I said, it's, you're a casual contact, then that's why every person needs to know where they have been. So it's not, again, it's taking levels of personal responsibility, because if I am saying also that people are actually getting, people who work in public offices and frontline workers are seemingly being exposed as well in public, or on a weekend. As I said, what we said with customs is we can give you all the PPEs when you're at work Monday to Friday, but on Friday, let's say you go to a bar, Saturday you go to a party, Sunday or somewhere else, then whatever cautions you took out through the week, you have thrown it out the window on a weekend, or even on a one night when you go to the bar, to the casino. So you should be able to know as a healthcare worker when you come to work on Monday where you have been and how I'm going to be protecting others. It's not only about protecting myself, it's protecting others as well.
Yeah. Can you at this point request to be tested? Okay, let's use the example. You are tested positive. We did an interview, I think it was like a week and a half ago, in person, socially distanced, after much sanitization. I know you're positive, I want to be tested. Can I go to the Ministry of Health and say, well, I was with Dr. Manzanero a week and a half ago. Can I get tested?
If you're symptomatic, you more than likely are going to be in line, right? Because it also has to do with the level of contact. Now, eventually down the road, after we clear up all what's happening Monday, Tuesday, Wednesday, I think you can kind of open it up more for all the asymptomatics. But it's also not that, because we also have long lines of people just saying, I want to be tested. I am afraid now.
So if I have a cough, then I would be tested. Or if I'm sniffly or...
If you're showing symptoms and you're a contact of somebody else.
Okay. So that's important for people to know at this point. And I have to ask you, from the beginning of this month to today, the 10th, it's over 100, almost 100 new cases that have been detected. Reflecting on all the work that's been put in, all the messaging, what are your thoughts when you see this sudden spike or this great increase in number of cases in just a matter of 10 days?
I think we assumed collectively that it wasn't here. I really think that everybody was thinking, we got into this mind frame of August 15th. We assumed that it perhaps wasn't that serious with the contraband situation. And I also think we were overtly concerned, granted we had to be, with today being August 10th, today would have been the first day of school. So you will notice that the municipal didn't really have to go and cancel any opening. We canceled it ourselves as a collective.
Yeah.
And I think the contraband situation is perhaps the similar situation in the West where I live. But I think the major change is the escalating number of cases in the North. I think that the only reason why the West has not seen any spike identified as yet is because you don't have so many cases in the bordering town. Now they are starting to grow. Metro is starting to grow in terms of number of cases, but I think obviously the more patients you have that are positive, the higher your risk of probability. Similar situation is going to happen west once you have escalating numbers and those trades continue to happen.
And Guatemala is reopening as well, so there's more possibility of movement.
Letting our guard down is because just this weekend, we got videos of people still having parties, a lot of parties, no regard for social distance. And I think there's a pretty good infographic going out now in terms of saying, we have also assumed that because they are my friend, that because they are my family, or because they are my co-worker, they are pretty safe. I see them every day, they look fine. But I don't know where they were this weekend. I don't know who they were with this weekend. So that's why
I saw that. It says that 3 of the most high-risk areas are people who work closely together, families, and the third one, I don't remember clearly, family functions. But basically, these are the people that you get together with and say, oh, they're safe. I don't have to wear a mask or I don't have to social distance. And that's where the spread takes place.
I mean, the church situation is
Yeah.
one in San Pedro as well. I
Yeah.
mean, so I think we let our guard down. We should never. I don't think the issue, even with the mask wearing in church, that was
Yeah.
never taken off the grid. Granted, we as a ministry couldn't come and possibly monitor everybody wearing a mask or not wearing a mask,
Or
nor
the
the police.
choir not wearing. I always thought that one was strange. It's a lot of droplets all in one. But lessons that we're learning along the way. We're running out of time quickly, and I have to get from you, what is the situation in Belize City? It is our most populated city, and currently the data we have, it's the entire district, which includes San Pedro. But let's talk about what is the status of Belize City and what are your projections as to where it's going to go?
I think the three cases that are positive and that the level of extent of contact that they may have had gives you a preliminary picture. I do know that yesterday there were 3 or 4 persons who are symptomatic who were at Karyushna, not necessarily hospitalized, but they were being seen at the flu clinic. So if we start seeing that similar trend today, tomorrow, then I think we can start. We may not be able to plug all the dots as to the contacts, because the 3 cases identified in Belize City through the weekend, Friday through the weekend, are linked to San Pedro and to Orange Walk.
Yeah.
So you may still be able to do, but it's the extent of what you're able to find from those preliminary cases what's going to give you a grasp. I think the next 48 hours are critical in terms of testing. I don't know how many are going to turn out positive today, but can we anticipate to get more? Yes.
Yeah.
Today, tomorrow, Wednesday. When we met as an NOC last week, Wednesday, my note to them is the next 7 to 10 days. So whatever we are able to identify up until Friday gives you a greater sense of where it's going to go. And things can change very dramatically, very quickly in the next 48 hours.
Mm-hmm. And of the 300 tests that are to be processed today, where are they from?
We have more than 100 being from San Pedro Central Health Region, about
That's
80
San
to
Pedro
90
and Belize City?
Belize City, yes.
Okay.
About 80 from Orange Walk, about 15 to 20 from Corozal. But we have samples also from PGs, Independence, Danriga,
Okay.
some in San Ignacio that were people who were in San Pedro. So it's from across the country.
And we'll have all of those test results today or tomorrow?
I don't think we're going to be able to process the 200 samples today, or even if they do, they're going to go right into the night, early tomorrow. But we should be able to put out information, and I'm assuming we're going to be having positives maybe around 7 this evening. Also, depending on where we find them, if we find a link, because we might not be able to. Sometimes, for example, Friday we try to get to the patients and try to link them up before we publish the data, and that's why we went after 11 o'clock. But if you're not seeing any potential link, then we're just going to have to start publishing numbers. And of course, once you have community spread, then there's no sense in trying to say to which cluster they belong. You just say, okay, X amount of cases in a given community, and that's where you have to report it.
Okay.
So we anticipate some results by around 7. Not the full 300, but I think the next 2-3 days are the critical ones. That can also shift around your decisions as to what you do from the health system vantage point.
Okay. Yeah. Well, thank you very much for providing an update for us this morning, Dr. Manzanero. We do appreciate it. Thank you, and stay safe.
Well, thank you, Isani and Marlene, for the invitation, and we'll see what Monday and the rest of the week provides. We do have a curve now, and it's only contingent upon every one of us to make sure it gets flattened.
Yeah.
Perfect.
All right.
Thanks, Doc.
Mm-hmm.
So with that, we go to our commercial break. And when we return, it's to have the first of a 2-part conversation in respect of the matter before the court regarding the redistricting exercise.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.